Welcome, everyone. My name is Dinesh Raju, and I'm going to briefly introduce my wife, Shveta Raju, to kick off BSI in Atlanta at Madmare. I'm going to make a joke first, and there's only a few people that are going to understand this, Greg and my father-in-law. So the joke is, what do you call two orthopedic surgeons looking at an EKG? Anyone? It's called a double-blind study. Okay? It's called a double-blind study. And the reason I make that joke is that, in very much contrast to specialists, primary care is the king of medicine, an absolute king. The hardest field in all of medicine is family practice. The second hardest is internal medicine and pediatrics. After that, everything else is easy. Surgery is easy, neurology is easy, because those fields are the broadest. And my wife, Shveta Raju, is a primary care provider in internal medicine. She began her training at Emory, not too far from here, did her undergraduate in anthropology and biology, and then went on to Emory again for medical school. And again, because I was very slow in finishing, did her MBA as well while I tried to catch up to her. Afterwards, she entered into a very competitive primary care residency at Massachusetts General Hospital, which is by far one of the oldest hospitals. We just passed our 250-year anniversary for our training program. And she was one of those key members in that department to lead the primary care division. Now, what's amazing about Shveta is that she has an uncanny ability to combine internal medicine, compassion for patients, but also a business mind. And what she's going to share with you today is her passion for introducing primary care medicine to the care of individuals. And she's going to showcase briefly what she has accomplished in her 13 years now at our clinic, Gwinnett Clinic. So without much further ado, I'm going to pass on the mic to Shveta Raju, who will kick off our program for this evening. Thank you.
Thanks, Dinesh, for that kind introduction. I'm not going to use my notes too much, but I do want to just kind of keep them close by. I'm really honored to be invited to speak today as part of this Broken Science Medical Society event. When Emily and Karin and I first spoke back in January of this year, we had discussed the possibility of hosting a group of people in physician homes. And that was a really compelling and exciting idea for Dinesh and I, because coming out of the COVID pandemic, we have been looking for different ways to connect with like-minded and compassionate individuals who want to try to help avoid some of the disastrous policies that we experienced during that time. So we're really excited about bringing together people who wanted to move forward in a positive way and understand science in a better way. As the year evolved, we talked about moving the event here to Madmare, and that was really exciting for us as well. For the last 6 years, Madmare has been a second home. This is the place where I've learned to improve my own health and fitness. I've been able to learn to coach human movement and been exposed to allowed many of my family members, as well as my patients and friends, to be exposed to Greg Glassman's methodology. So I really want to thank Tony Horenko and Suzanne McMartin for allowing us to have this event in this space today. To explain my deep commitment to the intersection of primary care and Coach Glassman's methodology, I have to start by mentioning my parents. And I'm so happy that they're able to join us today, Dr. Meena Shah and Dr. J.J. Shah. They grew up in 1950s and 1960s India. And the concept of optimizing their nutrition or structured fitness was not part of anything that they ever discussed. They had to walk everywhere because there were no cars. Squatting was part of life because there were no toilets. Food had to be obtained daily or every other day because there were no refrigerators. So that gives you an idea of the background of where they were coming from when they ultimately were able to study hard and gain admission into medical school. And that educational opportunity ultimately opened further doors for them and the opportunity to immigrate here to the United States. Because of their medical education, and really they didn't have anything else when they came here, they didn't have any connections, they were able to build the life that we all enjoy now, my siblings and my children. So I mentioned that because when we were growing up, we were really emphasized and encouraged to focus on academics. That was really what all of their energy was focused on, because what they knew was that if we focused on our education, we would continue to have more opportunities going forward. So fitness was really not part of my life either. I didn't participate in any team sports. I didn't compete in middle school or high school. Subsequent to that, I attended Emory Medical School, as Dinesh mentioned, and went to my residency at Massachusetts General. And all throughout my formal education, I was never taught about how I should eat, how I should teach my patients to eat, or how I should exercise to actually prevent some of the chronic diseases that we commonly see. In fact, my classmates and I were taught that these were diseases of aging. Most people would get into their 40s or 50s and find out that they had hypertension, diabetes, hyperlipidemia, or maybe a combination of those based on their individual predispositions. So the reason that I chose primary care was that it was exciting to me to be the initial physician to make these diagnoses, and then perhaps through my treatment and my relationship with my patients, prevent some of the more severe complications. So what are those severe complications? Organ failure, heart attacks, and stroke. Dinesh's path was a little bit different. He was a physician scientist, studied in the medical science training program, and he planned to study neuroscience and discover new ways to treat neurologic diseases. And I remember he would spend hours in the lab studying electron microscopy and the anatomy of the brain. And he loved that work. But then as we progressed through our medical school, as well as residency, first at Emory and then at Harvard, we just became increasingly aware of how political the academic medical system was. It was just so much more important that you had the right connections, you were asking the questions that were based on the current narrative, rather than actually seeking out truth or maybe pushing the envelope to ask new questions. And it was at that time that we really started to realize that maybe our contribution could be greater outside of academic science. So after our formal education, which we completed around 2012, we moved back to Atlanta. Then I started training in CrossFit in 2013 at CrossFit Johns Creek. And then we came together to Madmare in 2018. And we've been training here together ever since. And it was in 2019 that Dinesh started his educational journey, first with a Level 1 seminar here in Atlanta. And then in 2020, I was supposed to attend a Level 1 seminar at the ranch. That was moved online because of the restrictions of the COVID pandemic. But in 2022, we were able to go together to the ranch, thanks to an invitation from Karin, to attend the MDL2 seminar. So this was a group of physicians who already had their Level 1 and were starting to get a little bit of experience coaching and training. And that was really a turning point for us, because for the first time we were able to meet and interact with other physicians who were also interested, after having experienced the benefits of Greg's methodology in their own life, to merge it with their patient care. So from there, I would say it was like really the first time that I started thinking more seriously about how could I bring some of this to my patients more concretely. I would say 2024 has been the first year since 2019 that's felt normal in the clinic in terms of patient volume, people coming in for routine care. But we are definitely seeing the results of some of the policies that hurt our patients during the COVID pandemic. More than ever, people are staying home, they're ordering in, they're drinking more alcohol, they're not necessarily moving for their daily lives or for intentional pursuit of fitness. Many people are isolated and lacking in community, and as we all know in this room, the rates of obesity and chronic disease are skyrocketing. They're higher than ever. So it was in this context that we met Coach Eduardo Aranguiz earlier this year. Eddie has a long history in the fitness space. He traveled to Santa Cruz in 2009 to complete his level 1 seminar. After that, he pursued many different educational opportunities within the fitness space, mentored many coaches, owned his own affiliate in Chile, and then in 2022 decided to immigrate to the United States because of the political circumstances in that country. So when he came here, we spoke about the intersection of CrossFit and medicine, and he was really interested in learning more about Greg's methodology and how it could be used to improve health. And he decided to take on training as a medical assistant in the clinic so he could start to see what we see in primary care clinic every day. And I remember about a month into that, he came to me at the end of a long clinic day and he said, "The people here are really sick." There is so much good food around. It's affordable. There are so many beautiful places to train and exercise, but they don't take advantage of it, and all the time they come and ask for more medicine. I don't think I could have summarized the situation any better myself. And I think if any of you were to come into the clinic and see what we see every day, you would come to the same conclusion. And it's that realization that has led Dinesh, and with the support of the rest of our practice, to start to build some pilot programs to help bridge those two spaces. So, a couple more comments. I think we can all agree that our current medical system is on an unsustainable path. When my mom started her primary care practice in 1983, she would rarely see a patient who was on more than 1 or 2 medications. I would say now in 2024, it's rare to see a patient who's on less than 2 medications. In fact, most of our patients in their 60s and 70s are taking anywhere from 8 to 10 or more medications to manage their daily lives. I'm a physician and I prescribe medication. However, now that I have discovered, studied, and understood the effectiveness of Coach Glassman's methodology to actually prevent, cure, and treat these conditions, I feel a moral obligation to present that option to my patients. I believe that if my patients understand that if they pursue fitness and improve their food choices, they will improve their health outcomes at any age, regardless of the baseline that they start from. If I could choose one point for everyone to take away from my remarks today, which are about to conclude, I won't take too much more of your time, it would be on the importance of education. There is a huge education gap within the medical community in understanding Coach Glassman's methodology and why it's so effective to improve these conditions. At the same time, I think there's an education gap on the CrossFit and gym fitness side of understanding why the situations and circumstances of our average patient sometimes make it difficult to implement some of these changes. So we have sought to bridge that gap with some of the programs that I mentioned, and I'd be happy to share more details with anyone who's interested or have you come and visit and see how we're doing that. But I do want to share that I do feel optimistic, especially with the turnout here and the interest around all of these topics. I feel optimistic for primary care, and I feel optimistic for the future health of our patients. And we are really excited about the opportunity to continue to work with Broken Science, MetFix, Coach Glassman, and his entire team to prevent, cure, and treat chronic disease. Thank you. All right.